So do it right. Exercise, but do it right. Proper posture. Sleep in a good bed. You know that a mattress doesn't last forever.
សូមស្វាគមន៍មកកាន់ភាពបន្ទាប់នៃសុខភាពឆ្អឹងខ្នងរបស់លោកអ្នកជាមួយ ICC. Welcome back, Dr. Christophe.
Welcome.
We are really happy to have you for last week, and we also see that a lot of audience have been engaging. So this week, the next question for you, it would be if one patient or some patient having problem, for example, lower back pain or this herniation, usually how long does it take for the treatment to become effective for the patient?
Unfortunately, I cannot give you an answer. Why? Because every case is different. Not everybody responds the same. It's not a recipe. You got back pain, you do that, 3 days later you're better. And actually, a lot of people are watching YouTube video and they come here to see us and say, oh, I saw that video on YouTube and that person says in 3 days I'll be cured. It does not work like that. Every case is different. Your case, why you have back pain, might be a total different reason than that other person. So we tried through experience and we've been doing that, me and my team, for quite a few years. We try by experience to give an idea what to expect. Is it going to happen exactly like that? It's not even sure because, unfortunately, we depend on the compliance of the patient. By that, I mean, please, you have back pain, do not sit like that. Change the way you sit. Exercise, you need to strengthen this muscle, this core muscle. You need to stretch that muscle. You need to do this and that. I cannot make sure that you are doing that at home. And you cannot expect change in your health if you yourself is not willing to change your lifestyle. Whatever you've been doing, that's created that problem. So if one day you wake up with a bit of neck pain, yes, probably a treatment, whatever. If you're young, never been in an accident, it's going to get better very fast. But if you have 20 years of back pain, degeneration, this problem, it's going to take some time, but we'll do our best to get you there as fast as possible. Yeah. And we have a lot of tools in the clinic, a lot of different type of therapies and techniques because we are different chiropractors, so everybody has his own way of doing things. Yeah. So sometimes if that approach is not working as well as we think, we can go to another doctor, try a different approach. So all this is for the benefit of the patient.
One more problem that usually see is that some patient also asking questions like, why don't you give me medicine? Or is medicine going to be good for me to cut down the pain or relieve the pain? Yeah. So do you think it's a good idea for patient to think like
We are chiropractors, we are doctor of chiropractic, we are not doctor of medicine. So it's not part of our scope of practice to give medicine. So medicine, if you have a problem, you see your medical doctor, he will give you drugs, and it's absolutely not up to us to tell you to stop this medication. But sometimes it is a cultural issue where people do believe that they sometimes think that the more drugs they take, the better they will get. So they actually might see that doctor there, get a bunch of medication, they don't really feel better, they go see another doctor, get another type of medication, combine both, and that's not a good combination. So sometimes we tell patients, I think you're taking too many drugs, can you go back to your medical doctor and ask maybe to reduce, or you're taking twice the same drug from these two different doctors, choose one and only take one. But it's not our goal to tell patients about that. Us, we treat without drugs. Sometimes we know that the case is too late or will benefit from medication. So then we refer to doctors, orthopedic doctor, neurologist, general practitioner even. Sometimes patients come and they have back pain from something that is not related. We had quite patient coming because they had back pain because of kidney issues, they had back pain because of cancer, unfortunately. So then if we feel it's that way, we cannot take care of them and we send them back to another doctor.
Another question is that what do you see is the future of the chiropractic in Cambodia?
The future should be good. The only problem we have here is there is no Cambodian chiropractors yet in the country. Many fake chiropractors, unfortunately, people who claim to be chiropractors, they are not. They never studied in a recognized institution or have a diploma. The chiropractic is not a technique, it's a full-time degree. And I do know Khmer chiropractors in US, in France or in Australia, but they just don't come back in Cambodia. I hope that one day they will think that Cambodia is a place where they will practice. Because we are, it's not just ICC, to be honest. There are very few other real clinics in Cambodia, very few, unfortunately. And I really hope that the profession can develop. I still hope to get some legislation done with the Ministry of Health, but this is it's not easy. Mm-hmm. And I'm not Cambodian and I don't speak Khmer, sorry. So these steps are not easy.
Yes. So, what is the sign and the things that the patients should look for when they go into the chiropractor so that they can, avoid the
just look at the diploma. There is no, for example, there is no school in Asia except one in Malaysia. Mm-hmm. There is none in Vietnam for sure. There is none in anywhere. It's a 6 years degree, so you have to have knowledge. It's like it's a doctor degree. The course is actually very similar than doctors. Mm-hmm. That means we are able to do a proper diagnosis on the accident that happened in Thailand and or Vietnam are because people are doing things they were not trained for. We do manipulation of the vertebra. There is a lot of people who cannot get this manipulation. There are a lot of contraindications. So you need to see somebody who has knowledge and the ability to perform that act properly and to know, very important, to know if you are supposed to do it or not, mm-hmm. because you don't want to create problem. And for that, please make sure that you are seeing the right person.
Thank you so much for your clarification.
Okay, you're welcome.